Hello, everyone. Welcome to the Medicaid Podcast. I'm your host, Mitch Stewart. So let's get on with today's agenda. Nearly 60 million Americans are the recipients of Medicaid or CHIP, Children's Health Insurance Program. Included in this count are children, pregnant women, parents, senior citizens, and persons with disabilities. Though Medicaid is a nationwide program, each state engages in its own affairs independently of the federal government and is only required to provide certain mandatory benefits with the option of providing more. Both the federal and state government fund Medicaid. Their percentage paid by the federal government is known as the Federal Medical Assistance Percentage, or FMAP. However, states are obligated to secure the appropriate amount of funds for their portion of the healthcare services. Now, last year, President Barack Obama signed the Affordable Care Act into law, thereby enacting a series of health insurance reforms designed to expand coverage, hold insurance companies accountable, lower healthcare costs, and guarantee more choice and enhance the quality of care for all Americans. Since then, state and federal governments have been working together to ensure a seamless implementation phase, as the reforms expanding Medicaid coverage for millions of low-income Americans and making improvements to the Medicaid and CHIP programs, becoming active on January 1st, 2014. Now, focusing specifically on Medicaid expansion, all individuals between the ages of 19 and 65 with incomes effectively up to the 138% FPL federal poverty line based on modified adjusted gross income will become eligible for Medicaid on January 1st, 2014. However, states have the right to opt in or out of the medical subsidies that accompany the Medicaid expansion, which, as one would infer, is the subject of much heated debate. At first, the federal government bears the burden of the new costs associated with the expansion, paying 100% of the funding rate for the first 3 years, 95% in 2017, 94% in 2018, 93% in 2019, and 90% in 2020. If Missouri is to opt into the Medicaid expansion and the program does not pay for itself, Missouri may have to find a way to raise the funds necessary to fund the program, which means either allocating existing funds or raising taxes. In addition, analysts are predicting a phenomenon known as the woodwork effect. This event refers to the observation that approximately 60% of people who are eligible for Medicaid today have actually signed up for the program. And once this population that is already eligible but not enrolled will fall under the traditional FMAP percentage. Missouri Medicaid expansion models predict that in 2014 the number of individuals newly eligible for Medicaid will be 218,165, and that by 2020 this number will grow to 220,932. Well, everyone, that does it for this podcast. Tune in next week for more on the healthcare reform.